So secret hormones, we all know that the female hormones is estrogen and progesterone. So again, the female egg cell also undergo meiotic divisions. Follicle stimulating hormones, that is the one that is released by your anterior pituitary to stimulate the immature egg cell. And the immature egg cell is known as the oocyte. It starts from oogonia, and then it will become now your oocytes. Whereas in male, it starts as spermatogonia, and then it will become spermatocytes as it matures. In the female, it starts as oogonia, and then it develops into oocyte. And the follicle stimulating hormones, that is the hormones released from your anterior pituitary gland. Again, your hypothalamus, the releasing hormones, and then it will stimulate the anterior pituitary to release the follicle stimulating hormones. FSH is the hormones that will stimulate the immature oocyte to become mature. So during the maturations of the oocytes and with the influence of the FSH, the follicle stimulating hormones, the oocytes will gradually grow and it will mature. It will mature into Graafian follicle. Once the SFH stimulated the immature oocytes to become mature, the estrogen level also increases. Remember, FSH, that is involved with the estrogen. So once these immature oocytes become mature, it is because of the effect of estrogen. And at the same time, the estrogen affect also the uterine lining. Remember that. Estrogen affect the uterine lining during the maturation of the follicles into Graafian follicle. So it matures into Graafian follicles. And the effect of estrogen on the uterine walls is it thickened in preparation for the implantation of the fertilized egg. It is in preparation for the implantation of the fertilized egg if fertilization takes place. Because sometimes the woman ovulation happens, but there is no fertilization that happens. So menstruation will come. Menstruation will ensue, or it will happen if no fertilization will take place. In case fertilizations, so the uterine lining is already in preparation. And once the Graafian follicle, I hope I can move this one. Once the Graafian follicle mature, it will be expelled by the ovary. Ovary is a gland. Okay. Once the Graafian follicle is mature, the luteinizing hormones or LH is increased. It suddenly increased, the LH, luteinizing hormones. And the corpus luteum, during ovulation, the estrogen level becomes low and the progesterone level becomes high. So during ovulation, progesterone is high. And this corpus luteum also secretes progesterone. So once this is matured, it will be expelled by the ovary. And during this time, progesterone is the one that is high. And also the effect of progesterone, it also affects on the uterine lining. It thickens also the uterine lining at the same time in preparation for implantation of the fertilized egg if fertilization takes place. So once this is expelled, it will be expelled in the pelvic cavity. So this is your ovary. Once the egg is mature, it will be expelled, and this is your fallopian tube. During ovulation, so will be thickening of the walls of your uterus. Once the mature egg is expelled, this fimbriae, the finger-like structure, which is part of your fallopian tube, through peristaltic movement, the egg will move on your fallopian tube. So the egg now, the expelled egg will move to your fallopian tube, and this is where fertilization takes place. Fertilization takes place in the fallopian tube. So if fertilization takes place, then it will travel, when the egg and the sperm meet here, it will travel to the walls of your uterus for implantation. And it takes 3 to 5 days for that fertilized egg to reach the uterine wall. But sometimes there is an abnormality that happened wherein the fertilized egg stays in the fallopian tube. And that is what happened when there is ectopic pregnancy. So what happened when there is ectopic pregnancy, the fertilized egg cannot grow here in this area. It can rupture if it's not diagnosed early. The fallopian tube can rupture because of the growing fertilized egg. Do you follow? Huh?
Yes.
So that is what is happening here when fertilization takes place in the fallopian tube. So the ovarian hormones estrogen promotes maturation of the egg. It also maturation of the reproductive organs and the breast. That is the secondary characteristics for the effects of estrogen. Fat distribution in female, it is more on the thighs and on the butt. And there will be widening of the pelvis, menstruation happen, and then also closure of the epiphyseal disc. So once the girl starts to have her period, the epiphyseal disc gradually close. So we don't grow much as the male does. And then with the progesterone, it is the one that is responsible for the menstrual cycle. And also it is the one that is responsible for maintaining pregnancy. That is the medication that is given to women who have spotting during the first trimester of pregnancy, because that's the critical stage. Sometimes they experience vaginal spotting. So we give them progesterone so that the baby will not be aborted, or miscarriage can be prevented. It helps maintain pregnancy, and also it prepares the breast for milk production after pregnancy. That's also the functions of your progesterone. So the genital tracts you have here, the vagina, it's about 4 to 5 inches in length. 4 inches in length. That is the length of the vaginal canal. And it is lined also by rugae. So that's the reason why it is stretchable. It can be stretched when the baby is vaginally delivered. The vaginal canal can be stretched. And then you have your uterus, and then you have your fallopian tube. The uterus is lined by, there are 3 layers of the uterus. The inner layer is the endometrium. The middle layer is the myometrium, and the outermost layer is your perimetrium. The muscles that are contracting during birth, or when the woman has her contractions during delivery, it is the myometrium. It is the myometrium that is contracting. And then the layer that shed off, part of the layer that shed off during menstruation is your part of the endometrium. The endometrium has 2 layers. You have the basilar layer and the functional layer. The functional layer, that is the outermost layer of the endometrium, and that is the one that shed off during menstruation. Sometimes when you have your menstruation, you can see those like pieces of tissue that goes with the blood. You have seen that, girls? Huh? Ladies?
Is it like a clot? Like that?
Yeah. Not also like a clot, but sometimes it's you can see it as it's a little bit different. It's different from the blood clot. You can see that. And those are part of your functional layer of your endometrial tissue. That is the one that's shed off during menstruation, the functional layer of the endometrium. The ovary, you'll see it's not directly connected to the fimbriae or to the fallopian tube. The genital tract, you can see it is open. The genital tract is directly open into the pelvic cavity. This is your vagina. This is the vagina, and it is directly open to uterus, to your fallopian tube, and then this is your pelvic cavity. So if there is any infections that comes in through your vaginal canal, it can go directly to your fallopian tube. From the uterus, it goes to your fallopian tube and then to your ovary. And then here is your pelvic cavity.
Missy, I have a quick question. So when they say that they have, like for example, when you don't have a menstrual period, and there's the buildup of tissue around the would it be the uterus? Is that just because you don't have a menstruation and it creates that thick layer of tissue that just does not get like flushed out?
No, it's not. It's your progesterone level. There is a hormonal imbalance. That's the reason why you don't have your period.
No. I'm talking about like what causes the thickening.
It's the thickening of the walls of the uterus. It's the progesterone and estrogen level. That's the one that is making the walls of the uterus to be thickened. Okay. So if the woman does not menstruate, a woman has amenorrhea or irregular period, those layers will become thickened. The layers of the endometrium.
That's what I was asking. I was like, what is it called?
Yeah, amenorrhea, irregular menstrual period. So when there is a, because if it's open to the external environment, it can cause PID or pelvic inflammatory disease. And sometimes those PID, if the woman always on and off infections of the pelvic cavity, it can cause also sterility or infertility. So you have your fimbriae, it sweeps the ova into the tubes, site of fertilization. The fallopian tube is lined with cilia. It is lined with cilia. So sometimes if the woman develop pelvic inflammatory disease or PID or recurrent infections, those cilia can be um, gone. It can be destroyed, and it can form scar tissue on the walls of the fallopian tube. And when it does happen, this woman will have difficulty for of what you call that, getting pregnant because the egg cannot move swiftly or smoothly to the uterus. It will have a hard time of traveling from the fallopian tube to the uterus. It's good now because there is in vitro fertilization. So if a woman has problem on the fallopian tube, they can undergo, if they have a hard time of conceiving, they can undergo in vitro fertilization, wherein the egg and the sperm is fertilized outside and then it will be implanted on the uterine wall later on. So, but before, there is no such thing. So, woman who has problem on their fallopian tube will have difficulty of getting pregnant. So, ectopic pregnancy.
I have a question.
Okay.
You know how like some people say they have like PCOS, so like why does it cause infertility if like your ovaries are like overproducing?
Over what?
Isn't it like when your ovaries are like overproducing or something like that?
Sorry, I cannot understand what you're saying. Ovary is over.
Like overproducing? Like isn't like their ovaries overproducing like cause cysts?
No, there is no such thing as overproducing because only one egg is produced every month. Only one mature egg is produced every month.
Doesn't PCOS cause cysts in the ovaries, right?
What is it?
PCOS. It causes cysts in the ovaries. I don't know what it's called. I just know the short terminology to it. I don't know the full. But I'm pretty sure. Hold on. Let me look at it. Post polycystic ovarian syndrome.
Oh, polycystic ovarian syndrome.
Mm-hmm.
There are cysts in the ovary.
Mm-hmm.
So
Yes.
sometimes those cysts can block also the movement. If there, let's see here the ovary. If there are cysts here in the ovary, it can also delay or block the the egg to be expelled into the fallopian tube. It can block the ovary going the ovary. It can block the mature egg going to your fallopian tube.
Mhm.
So that's why it's also cause infertility. Any other questions? Did I answer your questions?
And is that the reason why it like causes the menstruation area, like having irregular menstruation?
Yes, it can cause
So it's
also
like
irregular menstruation.
so
Yeah.
it's also that relates to the imbalance of hormones and
Uh-huh.
why it causes like what's it called, acne to the body,
Na,
right?
acne.
'Cause that's one of the symptoms for it is the acne and like the menstruation, like irregular menstruation. So like, is the whole having a hormone disbalance what is causing the hormonal acne, or
Yeah.
okay?
Any other questions on this? So these are some of the problems with the tubes that can cause infertility. Scarring and blockage of the fallopian tubes, which is often caused by repeated sexually transmitted disease. Because when there is infections on the fallopian tube, as I said, it can cause scarring, and also it can destroy the cilia that is present there, that is present in the walls of the fallopian tube. So, so parts of the uterus, you have the fundus, and then you have the layers of the uterus. You have the endometrium, myometrium, and perimetrium. And then the uterus is connected to the vagina. And then you have here the fundus, the body, and then the cervix. The cervix is the one that they get samples during when they are doing the pap smear. They get a sample here, and then that's the one that they send to the lab for uh, examination to do the testing. It's here, it's the cervix. You have your cervical os, that is the opening of the cervix, and then you have the cervical lip. This is called the cervical os, the opening, and this is called your cervical lip, and this is your vaginal canal. So that is the connections of your uterus to the vagina. And the uterus is supported by a ligament, the broad ligament. This is a broad ligament. So pap smear is done for early detections of cervical cancer. Cervical cancer. So the vagina is lined by a rugae, and there is a hymen here. It's the hymen is a membrane that covers the vaginal opening. I don't have it here with me. Let me see. That's okay. So the external genitals, this is the vulva. Components of the vulva, you have your labia majora. This is the folds, the outer folds of the skin. And the functions of that is to prevent dryness of the mucosa. So the next layer, the next fold is called your labia minora. And then you have here your mons pubis. And then you have the clitoris. This is the same as the what is the same as the clitoris in male? Uh, the erectile tissue in male is the same as your clitoris. And then you have the clitoris contains the erectile tissue in the female, and it allows the female to experience pleasurable sexual sensation. That is the clitoris. And then the hymen is here, and it's the one that covers the vaginal opening. And then you have here your um, you have the perineum. This one is the obstetric perineum. This is where they do the episiotomy. If a woman is going to deliver vaginally, they do the episiotomy here. When you say episiotomy, they cut it. They cut the skin here so that it will give more room for the baby to come out. And then it is being sutured. The female sexual response, the erectile tissue in the clitoris and the tissue surrounding the vaginal opening swell when a woman is sexually excited or sexually stimulated. The breast and also the nipples, engorgement of the vagina, and secretions of the vestibular gland in response to the parasympathetic induced dilation of the arteries. So the breast feel engorged, and there will be secretions. There is your Bartholin's gland. Let me see if I have it here. This is your Bartholin's gland. This is the Bartholin's gland. It also secretes mucus, and also it aids. It works as a lubricant during sexual intercourse. So this is the Bartholin's gland, and it is located somewhere here on this area. There's where your Bartholin's glands are located. There is no Bartholin's gland here, but it is located somewhere here. So parasympathetic also increased blood flow, engorgement of the breast, the vagina, and secretions of the vestibular glands. That is your Bartholin's gland. In response to the parasympathetic induced dilation of the arteries. And then orgasm, stimulate number of reflexes causing muscle contractions in the perineum, uterine walls, and the tube. So there is also muscle contractions on those areas when a woman is stimulated and experiencing orgasm. Any questions on this? Huh? Any questions? I hope everybody good grades on this exam. If you have questions, ask it now so I can answer you. A number of hormones control the female reproductive. We have the monthly cycle, the estrogen and progesterone. So the purpose of reproduction is to mature an egg monthly for fertilization. A woman has almost 400 mature egg in a lifetime. But they only produce one mature egg every month. There are reserved around 400 eggs that can mature. It is reserved in the ovary. But only one egg can mature every month. So we have a lot of reserve until you reach menopause. The reproductive cycles, it works into cycles. You have the ovarian cycle and the uterine cycle. They always coincide with each other. And the typical cycle is 28 days, but there are some women who have shorter cycles, and there are women who have longer cycle. But the regular one is 28 days. So the ovarian cycle. So this is ovary. It has the follicular phase. When you say follicular phase, this is when the FSH, follicle stimulating hormones, stimulates the immature egg cells, the oocytes, to mature. So FSH, it will stimulate the maturation of the egg. Once it started its effect, estrogen level also increases. So estrogen and FSH, it triggers the maturation of the follicles. And the follicle secretes estrogen. Estrogen nourishes the ovum and the uterine lining. So this is your follicular phase. And then you have your ovulation or luteal phase. And then you have this is the luteal phase when the woman ovulates. If fertilization happened during this state, then the corpus luteum is alive, because this time progesterone